Hello, Dr. Rich Baez here again with you today, talking to you guys about head injuries. We've had a lot of questions over the past few days about slips and falls on the icy sidewalks, as well as people who are skiing and snowboarding. When they do take those falls, whether or not they need any sort of care or what signs to look for that would indicate that there might be something more serious going on than just a sore muscles or joints. So the number one thing that we talk about as far as head injuries are concerned is how you're sleeping. If you find yourself either waking up feeling tired still, or if you find yourself having difficulty getting to sleep and waking up throughout the night, that's a good indication that there's something going on with how your brain is functioning that's leading to that sleep disturbance. Again, that's usually very temporary after a head injury, but if it's lasting for 3-4 days afterwards, that's something that's worth investigating. What else we notice after head injuries is changes in your emotional state. Oftentimes we will become very agitated and have a lower threshold for our temper, meaning we have anger outbursts more frequently, whether that's at work or in the home. Also, on the flip side, we do see changes in things like depression coming forth, feeling very depressed or anxious. And again, after the head injury, that's fairly typical to see. But again, if it's lasting for more than 3 or 4 days, that's very abnormal and needs to be addressed. What actually happens with a head injury is a part of the brain called the brain stem becomes irritated, and also a part of the brain called the pituitary gland, which actually anchors the brain to the skull, again, becomes irritated as well. That's why we do see changes in the sleep-wake cycle, as well as changes in the hormonal balance in the body. So if you do find yourself dealing with these symptoms, whether it's sleep disorders, depression, anxiety, or anger outbursts, brain fog as a result of the fall, or even migraine headaches, those are all things that are associated with head injuries that, again, if are lasting more than a few days, are abnormal and need to be addressed. The work we do here, we specialize in assessing the brain stem to see how that's functioning. And again, if there was a head injury, that oftentimes is correlated with a brainstem imbalance and abnormality. So if you do find yourself suffering, you or someone you know, after a fall or a head injury with these symptoms, this would be the best place to go to start your investigation to get well again and just see if the care we do here is a fit for you or not. We do free consultations to see if this office is the best fit for you or not. If it isn't, we'll definitely find you the right fit. So again, stay safe this winter season, watch the icy sidewalks, and stay upright on those skis. And if you do take a tumble or someone you know does, just know that we're here for you to check you out and talk and see if we can help you or not. Have a great day, and we'll talk to you soon.